we might all say that COVID is actually the outbreak affects men and equal uniformly, or there's not much of a difference. And but the reality is that the United Nations Population Fund has pointed out that the disease outbreaks affects women and men differently, and the pandemic makes existing inequalities for women and girls worse. So, if in true sense, COVID is the infection may not be gender blind, but it does not make it gender equal. COVID has exacerbated and worsened harmful gender practices which women have faced, the systematic oppression for centuries. And in order, if you really want to salvage the progress that we have made, we have to advance the rights of women, girls, and the mentally ill so that we tackle structural barriers that are there. And if you know the amount of sexual barriers that people with mental illness face are humongous. For example, we have an act which is 3 years in operations. However, we could use it when the whole epidemic is happening, except that we don't have mental hospitals where we have full-fledged COVID services. We have partial services within the mental hospitals. Yeah, people might say that there are gender differences in mortalities. If you know, men are more are dying of COVID. However, having said this, we also should know that the social and economic effects of COVID are more negatively affect women. So this social distancing and lockdown probably was one of the greatest barriers that we faced in the recent time. And many of the people might say that, oh, what is it so great about social distancing? Because William Shakespeare, Isaac Newton did the best of works during the plague period. But we forget to note that both of them did not have childcare responsibilities, and that probably made them more effective than the others. Women are mostly the caregivers and care receivers. So if you look at the caregiver point of view, you have more nurses who are women. There are more the number of doctors who are there in healthcare services is gradually increasing. And to add to that, women not only work in different setups, they also are responsible to give care to family members in the house. So if you look at the additional burden and exposure that women face while they're taking care of their ill family members or their elderly family members, it has been heavily on women. We know that when men fall sick, it is the women who actually are responsible for the caregiving. And when husband and wife, both of them fall sick, the man might be able to be isolating himself, not do things. But very often, women have been the one who have to do the additional responsibility of taking care of the children and also cooking for the family. Yes, COVID to a great extent has been a neutralizer of the patriarchal systems that we have in society. We probably would say that men were made to do their own little jobs, but that's not the only thing, because I know several situations where women would say they're not doing the caretaker job, but every cleaning of the room of the partner who was isolated was taken care by women. The lockdowns also brought in this very uncomfortable situation where all services got closed down or delayed, and especially the mental health services. Because if you look at the mental health services, majority of the mental health hospitals either shut down partially, only looked at emergency services. Even the practicing mental professionals started working and operating from home very, very late in the day, while the medical health professionals probably started and providing online services. It took a lot of time. And if you look at it, the Association of Psychiatric Social Work Professionals was one of the first helplines that was set in the country with a whole base of volunteers. So if you look at it in that angle, you also look at how does it affect the when you're looking at the mental health effects on the women that we are surrounded with. We saw that the houses got more occupied because the husband was working from home, the woman was working from home, the children were having classes from home. And when school closures happened, women's informal caregiving actually increased because at one point she is supposed to sit in front of the Zoom session and see that the child is studying. On the other side, her husband was working, and so every need of his, probably earlier women got some amount of time and space to spend and relax in their house. But now it became 24 by 7. And look at the mental health stress that they really went into. And they being caretakers, they had the additional burden and anxiety. What if family members fall sick? How do we really care for family members who are sick? And it also meant that they couldn't send the children outside the house. And when they, in case they went outside, there were family members who would control them and say that you're not really taking care of these children. So you had this whole systematic reduction of space and power for women within their house. Now coming to the digital divide that happened in the household. When if you look at the educational component, when most families have one mobile phone or at the most one computer. So when you have to choose a computer or choose anything, it was the girl child or the woman who had to compromise on their time and adjust to the requirements of other family members. Women and work. If you look at women at work, women have always been on a indication that women have no access to sexual and reproductive health services. And that has led to a lot increase in child and maternal mortality. Women, the services have not been really there for women because a lot of the gynecology services were very really could not take up these services. Last but not the least, women were the frontline workers for all health and social welfare services. Like if you really look at what happened during the migrant movement, or what happened after women, people didn't have food to eat. A lot of the people on the ground were women workers. So if you really look at it, women were the forefront of providing welfare services. A lot has been spoken about women and mental health, and they have been a feeling that there are very conflicting reports coming in terms of is there while the Western world says that there is an increase of mental illness in the Indian space, people are still debating whether they have been increased. Whether it's increased or not, it's not the question. It is the aggravated circumstance in which people live in. Because when there is an aggravation of your symptomatology, or when you're having to live with that person day in and day long, it could mean life becomes very difficult. And those who probably wouldn't have sought services are now seeking services because there is an aggravated problem within their house. So there is issues about joblessness that is coming up. Just yesterday, I was dealing with a woman whose husband lost his job and he just left to his family, and then told her that if you want, you come. Meaning to say, and when she went there was a whole lot of abuse that this girl experienced. And to the extent that to make matters worse, he just sends her a divorce note, gives her saying that I'm planning to divorce you. So you look at the whole stress that is happening at the family level in terms of emotional levels that the women are really going through. And it's really sad because the situation is that we really don't have resources to take care, because the funding for mental health is very, very small, and to the extent of not being existent within the central government program, because most of the money goes to big mental hospitals and there's hardly anything left for community outreach. So there is this whole thing, and that's why the Global Mental Health Forum, that on their Mental Health Day, International Mental Health Day, they must ask for, they advocated for more funding for mental illnesses. Again, when we are looking at the mentally ill or the women, both of them are excluded from public and political decision making. And when it comes to COVID period, we've seen a lot of laws being promoted, there are a lot of policy decisions that happened, there were budget allocations that happened, but whether really looking at women's experiences, whether looking at the needs of the mentally ill, that powerful policy instrument should have been empowering, can actually become discriminatory towards the mentally ill and the women. To just give you an example in the sense of work from home situation, I'm flooded with a lot of people who have some form of mental disability, and all of them have lost jobs. They got into the IT sector because there was reservation. Now is reservation getting undone in this whole process of COVID lockdowns and restructuring that are happening, and they're not being really able to deliver within the work from home. The fears that they will not be able to deliver in the work from home situation. Again, something that is coming up on the news item is the leadership of women during the COVID times, and there is this reflection saying that they are doing better than their male counterparts. Yes, it's possibly true, but to what extent is this women's leadership? At what levels is being done? Is it beyond the heads of the states, or is it penetrated downwards? It's something that we really need to look at. And there are no responses, there are no indications to see that that response is there and is led by women. And we know that when women lead from the front, there are better responses on social indicators. Hence, when we want to, the whole call would be call for action is to increase women's leadership at all levels and see that women and people with mental illness or their families take part in the decision making process from the local level to the national level and looking at it in a gender equitable lens wherein you are positively discriminating in the benefit of people who are marginalized, who do not have access to services. It's not just that women have to be there. We have to consider that are these models that are there locally and nationally are women led, and do they have a right sort of a perspective, and do they identify barriers to participation and leadership in their decision making structures and determine access to dismantle those barriers. So we need the approach should be a balance. I'm not saying that it should be only women's focus. It has also implications for the transgender, where we know that a lot of transgender, if you are aware of, are in jobs which are informal or in sex work. And so men or women who are in sex work, then are we being gender balanced in those circumstances? Are we removing the barriers that are there? Are we giving them spaces to really work on? And it's nice that the government has recently brought out a mechanism to fund people who are in these fringes of society and see that they get some amount of humanitarian assistance. So the whole context is now, how do you remove those biases that are there within the humanitarian assistance and in our spaces that we work on, our mental health spaces that we work on, and how do we really increase funding for them? And how do you have champions who will work and advocate for the rights of the people who are on the margins? One of the foremost things that we really need to look at is that, are the staff who are working and providing services really equipped to deal with the challenges that are there, be it in the mental health space or in the social space? Do they really know how to deal with gender-based violence and the limitations of the response that we are putting across? Are they aware of how to dialogue, discuss, and work in partnership with the governments and with other organizations that are there, be it the hospital, be it the community-based organizations, or the NGOs, or the policymakers, the governments, the district administration? We need to look at supporting, do this organizations that are working with women or working with mental illnesses or mental health issues be able to overcome the barriers that they have faced during the COVID times? Have they got some amount of supportive help from others, or have they had to really give away what they are currently doing? Because what I hear is that the long stay homes, where they are mentally ill, the organizations are asking them to take the families back, the mentally ill back. The government has asked them to close the homes. And now where do they send the mentally ill who have no homes to go to? Government has taken the decision that they will not open up homes for the homes during this period, because there are issues in terms of taking care in groups. So you have these large issues that are there, and what is it that we are really going to see that people really work out? At one level, there are issues at the one-to-one level where people are having difficulties to live in the spaces that they have, be it their house, and some of them are reaching to services, some of them are slipping off from our hands. And there are those who are like homeless and who have been in shelters. They do not have a service. Children are another group that has been greatly affected, because with the school closure, with the restrictions of movement for the children, they do not have spaces to go to. And if you look at the data from 1098, they have reported a increase of calls from children. Even the women's helplines have reported a doubling of calls from women. So if you really look at it, the interpersonal violence has increased, the violence towards children have increased, children are getting abused. So, and women and young girls are likely to be taking additional burdens at home. Having said about women and the mental health, men also might have health issues because there's a higher mortality rate among men, and there's an excessive burden that is there. And very often there's a feeling that when we speak about women and gender or the marginalized, the men are left behind. So when we look at, there's a whole lot of studies that have been looking at what is the biology of men, what are the social risk-taking behaviors of men. Do women have certain illnesses which really aggregate? How do you really reduce mortality rate among them? And there is also a need, and most of the messages that are coming in are not either generic to all people, and there's no specific targeting for men. The question is, how are men navigating through these health issues of risk, trauma, grief, and loneliness? When I was working, I was counseling people from the industry. I realized that there was this tendency of families to send their wives and children back to their home, and the man will live alone. So when the person has COVID, the person is isolated totally. He has absolutely no family support because his wife and children are there. The loneliness is killing, and many a times they have found it extremely difficult, and with no caregiver along with them. It has been an emotional turmoil for the men, and the number of men who have experienced anxiety and depression during that period is humongous. And the simple reason is that our cultures make it that families should not stay together when there is an infection in the house. And most of these families are single earner men. And imagine if the man really has a complication, and there are some complications, the family might lose the whole bread earner for the family. If you look at it from a social supports point of view, women had a lot of supports from their local circles, their chit funds or buddy funds. They used to get a lot of support from them, and men had their own social network. Now, the COVID situation has really removed the protective element. When social support is something that is very protective, and we tell people to be extending their social support, COVID actually made it restrictive and saw that, and the message was loud and clear: you should not go and connect with people. Yes, some of the lucky ones were able to connect on the phone, but given that in Indian circumstances, families do not have phones for each member, families have restricted mobiles, probably one mobile in majority of the families, and that really makes it difficult for women to connect or for men to really have social circles that protect them from stress and anxiety. So just to conclude, what we really require is a gender responsive strategy that also incorporates concerns of the mentally ill. And we need programs that look at what are the risk behaviors that are there, how do you reduce, how do you provide supportive mechanisms and be there. And the importance is having an equity lens that will focus on all the marginalized communities, especially the men and women and the mentally ill. We also need to look at those people who are in places like prisons, people who are homeless, and those who are on the fringes of society, say, for example, working in fisheries units, working in cashew nut factories. So there are a lot of these places where women are higher in numbers, and we need to be there for them. If the call is towards like having a gender equitable strategy, and the question is that if we do not do it now, then when do we do it? Be it for mental illness or for gender? And when we are really looking at these policies and programs that we're really looking at, we need to give spaces and spaces for women to make decisions. And we need to build in processes that will ensure that women's participation is there at every level, at every arena, from the national committees to the local communities, where women take equal leadership and participation, and they have long-term consequences on communities per se. Thank you.
Thank you, ma'am. That was very insightful, and it was really engaging at the same time. I think she has talked about gender bias, and we got a very brief, I think, details about the gender roles. So, is there any questions for ma'am? You can leave in the chat box. So till the time we receive any questions, I would now begin, introducing Anita ma'am, since we did not get much time in the beginning of the session. So a little bit about her education background. So Anita ma'am has done her master's in social work from Mangalore University. She has also done her MPhil in psychiatric social work from National Institution of Mental Health and Neurosciences. She has done her PhD in psychiatric social work from National Institute of Mental Health and Neurosciences, and she has worked with a number of organizations such as Hands, then Pranjana Counseling Center, and it was really it's a big opportunity that we are being able to interact with you in this conference. So thank you for being a part of this conference, ma'am. Anyone who has questions for Anita ma'am can just leave in the chat box.
Hello?
Yes, Vijay sir.
Yeah. Okay. No, it's a request to the participant also, because it's a wonderful opportunity for us, because ma'am has a very wide knowledge in the field of mental health and all. So if our delegates can, make it a fruitful discussion with some of the issues that people, specifically that women are facing before, if you can say pre-COVID and also during, and regarding causes of domestic violence and other also health issues that affecting largely the mental health, specifically the women. Okay, so I think it's a wonderful opportunity for us to discuss with. Okay. Yeah, one question is there, I think, after ma'am.
What's the question? Because I'm not able to see the chat box here.
Yes, sir. Yes.
Can you read the question?
Yes, ma'am.